Students, let us continue the lesson health and disease. Today we are going to deal with the common health diseases. This is means not comfortable. So let us see the first disease, that is malaria. We are aware about the malaria disease. It is spread by the female mosquito Anopheles. So it is vector borne disease, but actually it is transmitted through the plasmodium, like Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, Plasmodium falciparum, of which Plasmodium falciparum is common. Many times the question is asked how the disease is spread. We call that it is spread through the mosquito, but actually the causative agent is Plasmodium, a protozoan. What are the symptoms of the malaria? Fever, headache, chills, and cyclic fever after 24 hours or 72 hours. It is followed by sweating and shivering, vomiting and convulsions. Convulsions we are knowing, liver enlargement and brain infection. So it is quite dreadful disease. Sometimes person goes in coma and finally there is a death. So why this occur? Because in our liver the sporozoite, this is the condition of the plasmodium, and there are cyclic changes, so the fever comes after certain interval. Mode of transmission, it is spread through female Anopheles. Now let us focus on the sexual reproduction in female mosquito. She sucks the sporozoite, the form of the plasmodium, from the human body who are already suffering from the malaria, and they inject the sporozoites into healthy person. Sporozoite through fission in liver, sporozoite they are turned into merozoites in liver, then they enter the merozoites into RBC, red blood corpuscle, and in RBC they also undergo change called to be the gametocytes for the sexual reproduction. So asexual reproduction occurs in human body and sexual reproduction occurs in female mosquito. These gametocytes in the body of the Anopheles, because she feeds on the human blood, these gametocytes they enter the gut of the female mosquito, and these plus minus gametocytes form the zygote. The zygotes become oocyst, means egg surrounded by the cyst, and this oocyst form large number of sporophytes through meiosis, and the sporophytes enter or migrate to the salivary gland of the mosquito, and again this mosquito inject these sporozoites to the human body. This is the cycle. In the examination, question may come, draw the malaria cycle. So one cycle occurs in the female Anopheles body and one in the human body. Here you can see that the sporozoites through this female mosquito have entered into the red blood corpuscles. In the red blood corpuscles they are taken to the liver. In liver they become merozoites. From merozoites they enter into red blood corpuscle. Red blood corpuscle rupture, and again it forms the gametocytes, they form these merozoites. Here you can see the cycle in the RBC. Ring shaped here schizont. Then it becomes tropozoite, again schizont, and again they rupture to give out merozoites. So in the human body, sporozoite to merozoite, schizont to tropozoite, and again merozoite. This is the cycle. So there is a fever after 24 hours or 72 hours. Then what happens? Already the person is infected. So he is malaria patient. Again this blood is taken by the female mosquito. She picks up these gametocytes which migrate to the intestine. In intestine this form the oocyst. Oocyst ruptured form many sporozoite. Sporozoite comes to the saliva of the mosquito. They are again injected. You can see here the picture of the plasmodium. This plasmodium is actually the causative agent of the malaria. Prevention. How to prevent the malaria? You have to use the mosquito repellent. You are knowing that good night is there. Then mosquito repellent incense sticks are there. Then mosquito net you can use. You can spray the insecticides surrounding your society, and you have to tame or keep gambusia fish in water so that they will eat the larvae and eggs of the mosquito. Amoebiasis. Amoebiasis is the other common disease because we eat or drink the junk food or eatables which are infected, and the flies they migrate from one place to another. Amoebiasis is common in the children. Signs are diarrhea, stool with mucus, abdominal pain, person feels to go again to the toilet. Sometimes the person passes blood in stool, and this Entamoeba histolytica is the causative agent which migrate to the liver and cause liver abscess, and you can feel chest pain. This is the causative agent Entamoeba histolytica. Sometimes the diagram is asked. Mode of infection to the fecal-oral route. Then what is meant by the fecal-oral route? Because we don't wash our hands, and through the nails these can enter your body. Eating with dirty hands, contaminated food if you eat and drink water, then these amoeba pass to your body. Treatment. Name of the medicine is metronidazole and tinidazole. When you are appearing for the medical examination, this is an important question. Prevention. Wash your hand with soap with hot water. Drink always boiled water. Use vegetables. Don't eat the raw vegetables. They should be cleaned properly. Sewage disposal. You have to keep your area to be clean. Another disease is the ascariasis. This is a common problem in the children. It is caused by Ascaris lumbricoides. This is the Ascaris lumbricoides worm. Symptoms: gastrointestinal discomfort, gassy stomach. You can observe the live worms in fecal matter, loss of appetite, vomiting and fever, mental confusion. Mode of transmission: contaminated food and drink. Eggs, when they through the vegetables, if they are gone to your body, the larvae migrates to the lungs and they again come to the throat and again swallowed in the intestines. So for 1 or 2 years the worms remain in your body. So single dose of mebendazole tablet is sufficient in 1 month. Prevention: avoid defecation in open space, because people have a habit for defecation in open space, because through the running water they come in our food or reach the our potable water. Washing hands with soap, use sanitizer, wash vegetables, because we have a habit of eating the vegetables or fruits without washing. Drink boiled water. Most common disease, dangerous disease, filariasis or elephantiasis. It is caused by Wuchereria bancrofti. You can see the elephantiasis. This is the Wuchereria bancrofti. Sign: edema, thickness in underlying tissue. It affects legs, arms, breast and scrotal sac. We call it the hydrocele. Limbs swell like elephant, because there is an accumulation of lymph fluid in tissue. Major disease is hydrocele. So water, it is coming in scrotal sac. Scrotal sac are filled with the water. You can see the swollen legs, elephantiasis. Mode of transmission. See here, this is an important question which is often asked. Culex mosquito, that should be a female one. Female Culex mosquito. In case of the malaria, female Anopheles. In case of Wuchereria bancrofti, it is Culex mosquito in filariasis. Larva penetrate human skin and it undergoes 2 moltings. It settles in lymphatic system. Its incubation period means it remains in the egg for 8 to 16 months. Treatment: name of the medicine is carbamazine citrate, twice a day for 3 weeks. Often the government they supply or distribute the tablets in particular season, rainy season. So government undertakes this responsibility. Typhoid. Typhoid is the another disease. You must have heard about the typhoid. It's caused by the bacteria Salmonella typhi. It is a gram-negative bacteria. Gram-negative means it is a staining property. The bacteria has flagella with H antigen and body with O antigen. So when the serum of the patient they are mixed with this bacteria, they cause agglutination. Typhoid is confirmed. Fever just to about 104 Fahrenheit. Person feels nausea, headache. This is called with enteric disease because abdominal pain is there, cough is there, tongue becomes white, then pinkish patches appear over the chest or the stomach or anywhere on the body. Anorexia means person loses hunger, person doesn't feel hungry. So you can see the fever, vomiting, abdominal cramps, diarrhea. Sometimes person passes blood in stool. Mode of transmission, it is also food and borne disease. Flies and cockroaches spread this disease. Poor hygiene, poor sanitation. Diagnosis: Vidal test. Vidal test means what? The blood is obtained from the patient, typhoid patient. It is mixed with the bacteria Salmonella typhi and reacted with the O and H antigen, and we can get the agglutination and the disease is confirmed. Surgical removal of gallbladder in severe condition, and the name of the medicine is chloromycetin. And the people can be vaccinated with typhoid 2LA vaccine. Remember, this is the multiple choice question or the medical born question. Pneumonia. It is a disease of the lung and is common in the rainy season. It is caused by virus or bacteria, inflammation of lungs, then cough, then green sputum. It is caused by the adenovirus. Streptococcus pneumoniae is the bacteria, influenza virus. Signs: cough produce yellow sputum, high fever, shortness of breath called to be the dyspnea. Dyspnea is the shortness of the breath, multiple choice question or medical question. Chest pain, loss of appetite, anorexia, fatigue, weakness, headache. See here in the picture, if this condition takes place, a runny nose. This is the on the right side we have shown here the virus. Mode of transmission via droplets. When someone sneezes, the droplets are spread. Prevention is vaccination. Medicine, ampicillin. Many antibiotics are there. You have to visit the doctor. Common cold is caused by the rhinovirus or coronavirus. Coronavirus, you are knowing nowadays. Each and everyone is knowing the coronavirus, corona vaccination, COVID vaccine. All these things are the. This corona strain is called COVID-19. Symptoms: cough, sore throat, runny nose, sneezing, conjunctivitis means eyes go red, headache, shivering, and this is generally. This can be if you take a rest, then this disease goes automatically away. This is the virus. You can see here the spike, protein spike over the virus. Prevention: cover your nose, face with handkerchief. Nowadays, what is common here? Mask. Your face should be masked one. Use alcohol based sanitizer. Wash your hands with the soap. So these are the basic things for prevention. Ringworm. This is the fungal disease, not worm. Fungal infection caused by trichophyton and microsporum. They feed on the keratin of skin, hair and nails. Red patch occurs over the face or anywhere on the skin. Scaly lesions and severe itching. Skin becomes whitish, powdery. If the nails are infected, they show the abnormality, and that is called to be the onychomycosis. Athlete disease of toe. You can see here the ringworm. Then this is the causative agent microsporum or downy. This is the athlete foot disease. Mode of transmission. This is caused by sharing of clothes and comb. Remember, your comb should be separate or personal. During sports, we exchange our jerseys, that should be avoided. Picandazole is the medicine. Control: avoid close contact, showering of clothes, use fungicidal soap, which we get in the medical shop. So in the examination, any question could come. Write symptoms of malaria or control measure of typhoid. What is Vidal test? What is the athlete foot disease? So this is very helpful to our general life as well as for the examination. Thank you very much.